So hi everyone, now students from third year BME going to have a discussion on case study titled on pedobarograph. Let's have a discussion. I start the discussion now.
Yes.
So last week I took my mom to the hospital and she's a diabetic patient. They usually take a blood test, but this time they took something called pedobarograph. I have no idea what it is. Can you guys explain me?
So pedobarograph, like it's there the name itself. Pedo means foot, bara means pressure, and graph is to write or record. So this basically is a test where you measure the pressure of the foot. That's it. Like a person is made to stand on a sheet and the pressure of the foot is measured.
Yes, Tarun, whatever you said is right. But can you explain here how this pedobarograph is related to the foot ulcer?
So basically the main problem with diabetic patients is foot ulcer, and how you can use pedobarograph is like people with foot ulcer, they will lose sensation in their foot. So when you try to identify the high pressure areas with this pedobarograph, you will be able to know if they have the sensation or not. If they do not have sensation, it means the ulcer is severe and they have to take the immediate treatment.
Yes.
Recently, I also gone through a research paper and during surfing. In Netherlands, the first country to initiate the pedobarograph in the latest university in early 60s, early 80s, and a 62-year-old type 2 diabetic person is gone through a high heel pressure, and by using the pedobarograph, they initiate the clinical research in the pedobarograph.
Yes, the foot ulcer is not only the application of pedobarograph. There are so many applications. Anyone is interested to share those
Let me
applications?
explain about the applications of pedobarograph. And in pedobarograph is not only used for identifying foot ulcer, but it is also used for gait analysis. Gait analysis means if a person is having some abnormalities in walking pattern, they will check it with this pedobarograph, and then after surgery they will monitor the foot pressure and the walking pattern of the patient. Then they will use it for flat foot and high arc detection, and which means it will check the deformities of the foot. Then it is also used in rehabilitation, like orthotic design. They'll have a foot pad which will be inserted in shoes to correct the walking pattern. Then they will track the progress, and in sports they will use it for athletic footwear, etc.
So he wrote about the applications, but if we move out of that, we have also seen many advancements in the pedobarograph. So when it was first invented, the pedobarograph was a large device and it could not be carried anywhere, and it had to be set in a particular room. But nowadays we have portable pedobarographs that can help you measure the pressure in any place that you want. So it has increased the convenience and also reduced stress on patients that have these foot ulcers. Also, he told about the athletes who are using this pedobarograph. So one of the biggest advancements is the sensors that are present. Like these sensors are now placed in the shoes of the athletes. First, I told about the athletes. Athletes are usually wearing shoes, and now the biggest advancement is that they have made shoes that have sensors inside the soles. So that helps us to identify the pressure right while they are running with immediate measurement, and it can also help us analyze their posture, and which then helps us to improve the performance of the athletes. Also, now there's the newest advancement is the 3D pedobarograph. So instead of just measuring the pressure, we can also use the 3D pedobarograph to identify the shape of the foot, and if there is an ulcer present, we can also be able to estimate the size of the ulcer. And all these have made treatment easier.
This sounds similar to thermography. It is completely different from the thermography, or it is similar?
No, thermography and pedobarograph both are visual images. What the main thing separate them is the thermography uses with the help of heat dissipation, it is used to detect the cancer. Whereas the pedobarograph with the help of pressure dissipation is used to use for foot ulcers.
Thank you guys for explaining me what pedobarograph is in like very simpler, very explained, like it defines what it is, and he explained like where it is from and who discovered it and everything, and advantages and application. Everything was very simple and it was very understandable for me.